If you are in nursing school and learning about ABGs, or you just want to learn about ABGs or arterial blood gases, more specifically with the interpretation of those ABGs, then stick around because I'm going to show you in this video just how to do that with an easy method.
Here's a new one by Nurse Master Charlie, the ABG song.
Is that a song about ABGs? It is a song about ABGs. I'll put a link in the description to the lyric video to that song. Hi there, my name is Nurse Master Charlie. Welcome to my YouTube channel. Welcome to my nursing channel. I am a registered nurse, and on my channel I talk about and share about nursing school related topics and tips, as well as health related topics, tips, and information. And like I mentioned, today's topic is on that of ABGs. I'm going to share about what they are and how to interpret them. Now, there are many ways to interpret ABGs. In this video about ABGs, I will be using the TIC TAC TOE method. This will be part 1 of a 4-part series. In part 2, I will be interpreting ABGs using a second method, one called the Rome method. Then, in part 3, once ABGs can be interpreted, I will be discussing about understanding fully compensated, uncompensated, and partially compensated ABGs. In the last video of the ABG interpretation, part 4, I will be discussing venous blood gases, or VBGs, and how to tell the difference between a VBG and ABG and why they are used. So be sure to look for those videos. So to start interpreting ABGs, let's move over to my computer. So what is an ABG? An ABG is the abbreviation for arterial blood gas. An arterial blood gas, or ABG, is an arterial blood test that is obtained from an artery that measures the amounts of arterial gases such as oxygen and carbon dioxide within the blood. An ABG measures the acidity or alkalinity or pH of blood and the levels of oxygen or O2 and the carbon dioxide or PaCO2 dissolved in the blood, or more specifically, arterial blood. Not to be confused with the venous blood gas, which I will be covering in another video. Now, a sample of blood from an artery is usually taken from the inside of the wrist, the radial artery, but it can also be taken from an artery in the groin, the femoral artery, or on the inside of the arm above the elbow crease, at the brachial artery. So first we must have a clear understanding of what normal levels that are associated with an ABG are. In many hospitals, the ABG results will include the pH, which normal levels are 7.35 to 7.45. There is something called the absolute normal of pH of blood, which is 7.4. The PaO2, or partial pressure of oxygen, which normal levels are 75 to 100 millimeters of mercury. The PaCO2, or partial pressure of carbon dioxide, which normal levels are 35 to 45 millimeters of mercury. The HCO3, or bicarbonate level, which normal levels are 22 to 26 milliequivalents per liter. The O2%, or oxygen saturation, which normal levels are 94 to 100%. The base excess is -2 to +2 milliequivalents per liter. Through the base excess, the amount can be determined whether the amount is an excess or lack of HCO3 or bicarbonate in the blood. A negative indicates a base deficit in the blood, or decreased base, which equals increased acidity. And last but not least, the anion gap. Normal is 10 to 15 milliequivalents. It actually measures the positive cations, the sodium and potassium, and subtracts the negative anions, the chloride and bicarbonate. The three that I will be focusing on will be the pH, the PaCO2, and the HCO3. So what does pH, PaCO2, and HCO3 mean? Well, pH refers to the acidity or alkalinity of the blood. The PaCO2 refers to the respiratory system or the lungs, and the HCO3 or bicarbonate refers to the metabolic system or the kidneys. A respiration is one inspiration and one expiration. In the inspiratory phase, oxygen is received into the body via the lungs and then enters the blood. During expiration, carbon dioxide is removed from the blood and into the lungs, then is removed from the body through the lungs. The respiratory system, primarily meaning the lungs, and the metabolic systems, primarily the kidneys, and secondarily the pancreas, all work jointly to maintain the acid-base balance of bicarb within the body, to keep it within those normal limits. Now, in other words, it's to maintain homeostasis. Did you know your pancreas makes bicarbonate? Yes, it does. Now, an ABG is usually obtained from an artery, usually the radial artery, but the brachial and femoral arteries can also be used. But also, utilization of an A line, also known as an ART line or an arterial line. The ART lines are usually used in patients in the critical care setting. Now real quick, ABGs are usually obtained by phlebotomists, nurses, or respiratory therapists, and a quick Allen's test must be done to assess the circulatory status in the wrist and hand if the radial artery is going to be used to obtain a sample. I'll put a link in the card to my video on pulse assessments, which demonstrates what and how to perform an Allen's test. And if you want to see a video on how to actually draw an ABG, leave me a comment, and maybe I will make that part 5 in this series. In order to understand pH a little better, it is good to know what pH actually means. pH by definition means the power of hydrogen. But what does that actually mean? pH equals negative log multiplied against the hydrogen, or pH equals negative log times the hydrogen ions. pH is inversely proportional to hydrogen ions. So if pH is decreased, then hydrogen ions are increased, meaning it is more acidic. If pH is increased, then hydrogen ions are decreased. That is why less than 7.35 equals acidic and greater than 7.45 equals alkaline or increased base or basic. And like I mentioned, pH is inversely proportional to hydrogen ions. Decreased pH equals increased hydrogen ions, equals it is more acidic. Increased pH equals decreased hydrogen ions, and as they are decreased, it is more alkalotic. This is why less than 7.35 equals acidic, and greater than 7.45 equals alkaline, or increased base, or basic. Let's use a bucket of water for getting any reaction that could occur. Let's add acid to the water. The more acid, the more acidic, and lower the pH. Carbon dioxide, or CO2. PaCO2 refers to the partial pressure of carbon dioxide. This is a measurement of carbon dioxide within the blood. A high PaCO2 would indicate respiratory acidosis, and a low PaCO2 would indicate respiratory alkalosis. Bicarbonate, or HCO3. Bicarbonate, or HCO3, measures the concentration of bicarbonate in the plasma of blood. Just for your information, to actually measure bicarbonate, a formula known as the Henderson-Hasselbalch equation is used. Just know that it is a calculated value, whereas when it is obtained from a blood sample in a metabolic panel, it is a direct measurement. Bicarbonate equals base, like a bass drum. So what are normal levels in an ABG? A quick review. pH is 7.35 to 7.45, PaCO2 is 35 to 45, and HCO3 is 22 to 26. So I switched this up a little bit. I switched the PaCO2 to have the greater than 45 in the acidosis column and the less than 35 to be in the alkalosis column to match up with the pH and the HCO3 in the acidity area and in the alkalotic area. And then I put the absolute normals on the far right. So why does a high PaCO2 move to the acidic side? CO2 is an acid, and if a respiratory rate is decreased, the acid levels build up and lower the pH. Remember, pH is inversely proportional to hydrogen ions. So if pH is decreased, then hydrogen ions are increased, meaning it is more acidic. If pH is increased, then hydrogen ions are decreased. So interpreting ABGs using the TIC TAC TOE method. In the ABG TIC TAC TOE, it is vertical only, no horizontal lines. So let's practice some examples of the ABG interpretation using the TIC TAC TOE method. Here we have our normals. Here we have our pH of 7.55, a PaCO2 of 44, and a bicarbonate of 33. Well, the pH is 7.55. It is greater than 7.45, so therefore it is a base. The PaCO2 is 44, which is actually normal. And the bicarb, or HCO3, is 33, so it is on the base side. So if you play tic-tac-toe, we have metabolic alkalosis. Here's another one for you. Here's our normals again. And now we have a pH of 7.30, a PaCO2 of 55, and an HCO3 or bicarbonate of 24. Our pH is acidic. It is less than 7.35. Our PaCO2 is actually acidic. It is greater than 45. And our bicarb, or HCO3, is normal. We have tic-tac-toe. We have respiratory acidosis. So I presented some information about ABGs and showed you a couple of examples to get you practicing. And like I mentioned earlier, this is part 1 of what is looking to be a 4-part series. Be sure to catch part 2, where I will be interpreting ABGs using the row method. Then in part 3, I will be discussing about fully compensated, uncompensated, and partially compensated ABGs. And then part 4, where I will be discussing venous blood gases. Now, if you are interested in health information and nursing related content like this, then I'd like to invite you to subscribe and be part of my nursing channel. And also hit the notification bell so you can be made aware of when I make new videos, like the upcoming parts 2, 3, and 4 of this ABG series. Also, don't forget to share this video, especially with those of you who are struggling with ABGs or just want a little bit more information about ABGs. And be sure to share with those of you who are in nursing school, starting nursing school, or are in pre-nursing school. Please be sure to check out my many other nursing topic related videos, which range from nursing assessments to the 5 rights of medication administration, as well as my nursing and health related music lyric videos here on YouTube. If you are not aware, I write and create nursing and health related educational music. So be sure to find my new ABG song here on YouTube, and also my other songs like What is Diabetes, Check Your Feet, the Flu Shot song, the Nursing Process song, What Are Vital Signs, to name a few. So if you like music and want to learn a little something at the same time, please be sure to check those out. You can also listen and take my music on the go with you, anywhere to keep you inspired. My nursing related songs are on all music streaming platforms, Spotify, iTunes, Apple Music, Pandora, etc. Also, please be sure to check out my nursing blog on my website, www.nursemastercharlie.com. I post new nursing and health blog articles weekly related to what I share here on YouTube, Instagram, TikTok, and Twitter. I'll also leave links in the description. So until the next video, go save lives and make a difference. God bless, and bye-bye.
Arterial blood gas or the ABG measures blood acidity and alkalinity. Arterial blood gas or the ABG measures blood acidity and alkalinity. Arterial blood gas or the ABG measures blood acidity and alkalinity. Arterial blood gas or the ABG measures blood acidity and alkalinity. 7.35 to 7.45 in an ABG.